Hi and welcome back. So new guidelines released in 2022 have now called into question the well-established benefits of taking aspirin at a daily dose in the fight against cardiovascular disease and also cancer. Enough waffling off me, let's jump into the latest research on a daily dose of aspirin. Aspirin as a drug is available for people to buy over the counter without a prescription for relieving headaches, minor aches and pains, fevers, and some people also use it as an anti-inflammatory. Doctors, on the other hand, may administer aspirin immediately after a heart attack to prevent further clots and heart tissue death. And there are links in the description below to the studies and the articles I used to put this presentation together. Aspirin is a non-steroidal anti-inflammatory drug, NSAID, and was the first of this class of drug to be discovered. As the name implies, non-steroidal anti-inflammatory drugs are not steroids. Steroids often have similar benefits, but they're not appropriate for everyone to use as they can have unwanted side effects. Aspirin contains salicylate, a compound found in plants such as willow tree and myrtle, and it was first recorded around 4,000 years ago. Ancient Greek physicians used willow bark for relieving pain and fevers, and some people still use willow bark today as a natural remedy for headaches and minor pain. The daily use of low-dose aspirin, often called baby aspirin, can lower the risk of cardiovascular events in some people, although it's not safe for everyone. The Food and Drug Administration recommend only using aspirin in this way under the supervision of a doctor. In people with a high risk of cardiovascular events, low-dose aspirin can reduce the risk by preventing blood clots from forming. A doctor may recommend a daily low-dose aspirin for people who have heart or blood vessel disease, have evidence of poor blood flow to the brain, have high cholesterol, have high blood pressure or hypertension, have diabetes, or people who smoke cigarettes. The 2016 recommendations from the United States Preventative Services Task Force say that adults between the age of 50 and 59 may take aspirin daily to prevent colorectal cancer as well as cardiovascular disease. However, this guidance only applies to adults in this age range who have at least a 10% 10-year risk of cardiovascular disease, do not have a high risk of bleeding, have a life expectancy of at least 10 years, and are willing to take a daily low dose of aspirin for at least 10 years. More on their 2022 recommendations in just a moment. Let's firstly look at heart attacks. Aspirin interferes with the blood's clotting action. When a person bleeds, clotting cells, called platelets, collect at the site of the wound. These platelets help form a plug that seals the opening in the blood vessel, therefore stopping the bleeding. But this clotting can also occur within the vessels that carry blood to the heart. If blood vessels are already narrowed from a buildup of fatty deposits in the artery, a fatty deposit in the vessel lining can tear, exposing the blood to the inner wall of the artery, which then clots. These clots prevent blood flow to the heart and can cause a heart attack. Aspirin therapy reduces the clotting action of the platelets, possibly preventing a heart attack. Robert H. Smerling, MD, the faculty editor of Harvard Health Publications, writing in the Harvard Health Journal, said, "For people in the US aged between 51 and 79, a routine dose could, over a 20-year period, prevent 11 cases of heart disease for every 1,000 persons, prevent 4 cases of cancer for every 1,000 persons, lengthen national life expectancy by about 4 months, allowing an extra 900,000 people to be alive in 2036 and save $692 billion in medical costs." Research cited by the Princeton Longevity Center, link in the description below, described the combined findings of multiple studies. Overall, the authors found that the risk of developing cancer was reduced by almost 25% after 3 years of taking daily aspirin, compared with a control group that did not take aspirin. After 5 years, the risk of dying from cancer was reduced by 37% for those who did take aspirin. The effect was mainly seen for a particular type of cancer called adenocarcinoma. This type is often seen in colon, lung, breast, esophageal and prostate cancers. The researchers also found that daily aspirin may have a significant effect in reducing the risk of an existing cancer spreading to other sites in the body. Over a follow-up period of 6.5 years, there was a 36% reduction in the spread of cancer to other parts of the body when aspirin was used. For colon cancer, there was a 74% reduction in the risk of the cancer metastasizing. Overall, the death rate from cancer was significantly lower in those who took a daily dose of aspirin. There is a link to this site in the description below, but I found the actual wording in the report interesting compared to the wording of the title. As we know, people just love to click on sensational titles, but then don't bother to read the full report. Please read the full report and see if you can see where it states CRC and aspirin specifically, and not CRC as an add-on to a cardiovascular disease statement. This is the title of the paper on the JAMA page. No mention of cancer, only cardiovascular disease. So on the JAMA page, under the subtitle Evidence Assessment, it reads, the USPSTF concludes with moderate certainty that aspirin use for primary prevention of CVD events in adults aged between 40 and 59 who have a 10% or greater 10-year cardiovascular risk has a small net benefit. No mention there whatsoever of colorectal cancer. My takeaway is that there is some benefit, even if it is moderate. And I have to ask, who's using aspirin as a primary prevention? I think that should be something like regular exercise, a whole food diet, not smoking cigarettes, sensible alcohol intake, etc. Please let me know what you think primary prevention should be. The task force concluded with moderate certainty that aspirin use for the primary prevention of CVD events in adults aged between 40 and 59 who have a 10% or greater 10-year risk of CVD has a small net benefit. Notice how they highlight small benefit twice, but don't draw attention to their use of the word moderate certainty. I would be interested to know where moderate certainty sits in their taxonomy. Wherever it is, moderate is not high, and it certainly is not conclusive. I urge you all to read the full report and not just go on the small snippets I found worthy of note here with regard to CVD and not to cancer. Annual bleeding events in individuals without risk factors for increased bleeding, such as a history of gastrointestinal bleeding and a history of peptic ulcers, etc., are rare. But the risk for bleeding increases modestly with advancing age. My comment again, where does modestly sit in their taxonomy, and is it really worth worrying about? For persons who have initiated aspirin use, the net benefits continue to accrue over time in the absence of a bleeding event. So here they say that there are benefits and that they increase the longer you take it, as long as there are no bleeding events. The net benefits, however, generally become progressively smaller with advancing age because of the increased risk of bleeding. And modelling data suggests it may be reasonable to consider stopping aspirin around the age of 75. Again, in my humble opinion, using words like may be reasonable and consider stopping are all very vague, and becoming progressively smaller doesn't mean disappearing altogether. Again, let me know if you think these statements are clear and concise and leave you in absolutely no doubt about what to do in the future. Let's now cover dosage. Healthcare providers will normally discuss what aspirin dose is right for you. According to numerous studies, low doses of aspirin, such as 75 to 100 milligrams per day, but more commonly 81 milligrams, can be effective at preventing heart attacks, stroke, and some cancers. Healthcare providers can also prescribe a daily dose of between 75 milligrams and 325 milligrams a day. That's a regular strength tablet. Having recently spoke to my doctor, I'm currently taking 81 milligrams of aspirin per day. Let's now look at some of the risks. Like most medicines, aspirin may have some side effects. It may irritate your stomach lining and can trigger gastrointestinal upset, ulcers, and also bleeding. And because it thins your blood, it can be dangerous for people who are at a higher risk of bleeding. Factors that make preventative use of aspirin dangerous include the use of other medications that are designed to specifically thin the blood, a history of gastrointestinal ulcers, bleeding or gastritis, kidney failure or severe liver disease, and also bleeding or clotting disorders. To date, I have not had any ill effects, and my latest blood test shows no large changes at all. So I hope you found it interesting or informative, hopefully both. I've made some notes that I'm going to read from, so I make sure I cover everything that I want to. So according to the latest recommendations, aspirin is not going to help me if I'm over 60, unless I want to take it for 10 years, but then I should also consider stopping before I reach the age of 75. So I think unless things change, I'm going to be taking low dose aspirin for the next 17 years. But also looking at the latest recommendations, there's a moderate chance, only a moderate chance, that would help prevent some events or diseases, usually aligned with the aging process. So if it's moderate, I'm going to take that, so I shall still continue to take aspirin for the next 17 years. Let me know if you take low dose aspirin and let me know the reasons why. And also, now you've seen these latest recommendations, if you've been taking it for more than 10 years and you may be reaching the age of 75, are you going to consider stopping? Please also remember, this is not medical advice. This is just me reporting on the research or the guidelines that have just been released earlier on this year. So if you do think you're going to start to take aspirin, or you want to reconsider the dosage you're taking, please talk to a medical professional and get the advice from them, and not on the strength of what I've covered in this video. Well, that's it for today. I hope you've enjoyed the video. I look forward to seeing you in the next video. As always, please take care, stay safe, and I'll see you soon. Bye for now.